So there's another one who asked me if guyabano leaves, garlic, ginger, and turmeric can cause anemia. Okay. First thing foremost is that if you're having cancer, or if you have cancer, one of the symptoms of having cancer is chronic anemia or occult bleeding. It means that there's a form of bleeding but you cannot see it. And you would have anemia if you have cancer. Now, let's consider what anemia means. Anemia is mababa yung hemoglobin or hematocrit sa katawan. Okay, yung pula sa dugo. If people ask me if guyabano leaves, garlic, ginger, turmeric can cause anemia, the answer is no. Okay? Baka nataon lang.
She has stage 3 breast cancer, and she prefers not to undergo chemo, Mom, and she wanted to do natural. She thought, what would be some ideas that you would recommend as far as a natural treatment for that?
Of course, the best anti-chemo natural herb for me is ginger and guyabano leaves. And I have said this many times ago, that when I was in UP, we were having all of our products tested, and they were testing that, and it came out to be guyabano leaves. Okay, do not drink guyabano wine, because guyabano wine, it has an alcohol on it. Okay, and alcohol has been attributed to cause cancer as well. So it's better to get the fresh plant if you have it. Fresh plant, you plant, okay? And then just boil them, as many as you can. And it's also not true that guyabano leaves can cause anemia. So it has never been demonstrated, for me, at least for me, in clinical practice, I have never seen. Eggs and chicken, if they can be eaten if you have cancer, okay? Now, there's a lot of people that will tell you, do not eat that, okay? And the question for them is why, and where are the research? Kasi naririnig nyo yung malansa. What does that mean? Does that mean meron kang allergic reaction towards that certain food? Kasi if you have an allergic reaction with this food, then it's better to not eat all of that. But if you're gonna ask me, eggs and chicken, they're a good source of proteins. And pag cancer patient ka, you need a lot of proteins kasi you have muscle wasting. So a good source of protein can come from this product, okay? And just make sure that they are organic, always organic. And when I talk about organic, it means they are not injected with hormones, with antibiotics, and they are not being fed with feeds, okay? Because they have an effect on our body too. So people ask me all the time, what is the best food if you have cancer? The best food if you have cancer is the foods that are bitter. Those are the ones that you should be concentrating on eating more. And this is based on my 20 years experience as a medical doctor, and based on all the books that I have written and read as well. And there's a lot of research that says that bitter foods are good for us. So we should start eating bitter foods, just like ampalaya, and some leaves too that we think that we're not supposed to eat them, like papaya leaves. Actually, in some of the other countries, they're eating papaya leaves too. So I hope that this short video will be able to help you. So you have been diagnosed with cancer. What necessary changes should you do with regards to your food? First is you have to remove all excess sugar in your food. Do not eat artificial foods or dyes or any food that is processed and refined. Remove also oxidized seed oils. People ask me too if chemotherapy is effective, and the answer is sometimes. So a lot of people ask me about the side effects of chemotherapy and radiation therapy, and I always say that they have acute, subacute, and chronic side effect whenever they would undergo
such treatment, but I think people do not realize that the worst side effect of chemo and radiation is they can in itself cause cancer. About nutrition, minerals, vitamins, if they interfere with their chemotherapy. And the answer is no, it does not interfere with your treatment. When it comes to cancer, prevention is really important. And the majority of cancer are preventable. And if we live a lifestyle that is hostile to cancer, then most probably we will not have cancer. I hear a lot of people when they have cancer, they will say that it's all bad luck. But actually, if you have cancer, it's more complicated than that. It's not bad luck. You did this to yourself by the lifestyle that you were living. You were not good when it comes to your food. You were eating more processed food, a lot of sugar, and you're not exercising. You're smoking. You're an alcoholic drinker. So when you have cancer, majority of that is because of different factors. And it's only around 5 to 10% genetic. I actually have a problem with this statement. You are what you eat. I think that's not a good statement because we eat things but then we don't absorb them. So I think we should just change that and make it we are what we absorb. That's even better, I think. You are what you do. So if you gossip all day, then you're a gossiper. If you teach all day, then you're a teacher. If you waste your time doing bad things, then you're a bad person. You are what you do. So be careful.